Hello class, my name is Alexis Kogan. I'm a student at GCU and I'm going to be doing my clinical test presentation on glucose determination, kinetics, and urinalysis for my patient X. So the overview of my patient is going to be a Hispanic woman whose age is 60. She has a current weight of 185 pounds. She has a height of 5 feet and 3 inches. The patient's blood pressure vitals are 130/85. She does present to my office with symptoms of frequent thirst, a substantial appetite, and increased exhaustion or fatigue. My initial hypothesis for diagnosis was a possible case of hypoglycemia due to fatigue, eating habit, and excessive thirst. I actually meant to type hyperglycemia, so that is a typo, but we will move on. So the clinical tests to be performed on my patient are going to be glucose determination tests, including a glucose meter test, a Benedict's reagent test, and a urine strip test. So over here, you can actually see I added in the corner on the top right of my presentation, hyperglycemia is going to have high sugar. Normal level will have a normal level of glucose, and hypoglycemia will have low sugar. So in my patient's case, she did have a high level of sugar in her results. So that was where my hypothesis of hyperglycemia is stemming from. So the glucose meter test, just to go into a little bit about what that test is going to be a test that is used with a device where you will prick your finger and you will use the blood to apply to the test strip to be able to allow the glucose oxidase that is located in oxygen to react with the glucose that is located in our blood to react to form the projects of hydrogen peroxide and gluconic acid, which will allow a reaction from small voltage on the test strip to be able to oxidize, and it will create a current that we will be able to obtain a measurement of the glucose from the concentration. Going further into another glucose determination test, we also have the Benedict's reagent test. This test is used to determine carbohydrates, which will determine a color change from the Benedict's reagent blue coloring. The color changes are going to result from the copper reacting with the aldehyde group, causing oxidization of the group to turn into a carboxylic acid. Then, based on the level of glucose that is seen in the urine, will determine the color change. For this specific test, you can see that a negative reaction will have a closer to like a blue tealish color, whereas if there's 100, a level of 100, then it'll be closer to a lighter green versus a 250 level. We'll have a little bit of a darker green, and it'll continue to get darker, going all the way up to a dark brown if there's a level of 2000 or above. And on that test. Moving on, I hear my daughter in the back. The urine strip test is going to be a rapid test that is used by inserting test strips into the patient's urine to determine the levels of calcium, glucose, bilirubin, ketones, creatine, urobilinogen, pH, protein, leukocytes. We'll be able to obtain lots of different measurements from this test. This test will use a reactant, hydrogen peroxide, to react with a reactant called horseradish peroxidase, along with potassium iodide, which all three will ultimately oxidize and result in a color based off of the glucose level that is seen in the urine. So looking at that test, we will have a bluish color if it's negative and a greenish color if it's around 100 to 250. Moving even further, if the levels are higher, going like 1000 to 2000, it's going to be shades brown, seen on the test results. So further clinical tests to be performed on my patient will be the CK test and the LD test, which is the creatine kinase test, and the lactate dehydrogenase hydrogenase test. The CK measurement that is normal for adult women would be 15 to 160 UL and 15 to 130 UL for adult men. Whereas the normal LD levels for adult women are going to be 100 to 255 UL and 100 to 255 UL for adult men. In my patient's case, she is an adult woman. So for her CK levels, they would need to range between 15 to 160 UL, and the LD levels would need to range between 100 to 255 UL to be normal results. The enzyme kinetics test for these measurements are going to be a catalyzation of the enzymes, which is measured by a spectrometer to determine the level of absorbance. So these tests are really great in helping determine what is kind of going on a little bit on a deeper level with the glucose in our body. So further clinical tests that will be performed on my patient will be a urinalysis, a protein test, a ketone strip test and bilirubin test, a pH and specific gravity test, and an Ehrlich's reagent test. So going on to the urinalysis test, it will be administered by obtaining a patient of our samples, a sample of our patient's urine, which will be reviewed underneath a microscope to determine the potential results that will be obtained. A protein test is one of the most common tests that will be used to determine a measurement of protein within the blood sample provided by the patient. It can also be measured in the urinalysis as well. And high traces of protein can be further indications of diseases such as within the kidney. A ketone strip test and bilirubin strip test are going to be measurements of the ketones within the patient's urine, and that can be a sign of diabetes if there is a high sign of ketones. A bilirubin strip test would be a test to determine if bilirubin is within the patient's urine as well, as it typically is not, and is typically can be found within liver failure in a patient. Specific gravity strip test and pH test will be determined to find out the pH level given the urine, so whether the pH is going to be acidic or alkaline. The specific gravity strip test determines if the patient's kidney is functioning as expected and is able to concentrate urine as normal and expected. The Ehrlich's reagent test will determine the impact of LSD, and the color is typically purple for that test result. So the glucose determination results for my patient X was the glucose meter read a value of 200 mg/dl. This value is considered to be abnormal as it is too high and elevated. A normal range is from 70 to 100 mg/dl, whereas my patient's was double the normal value. So that is considered to be abnormal already for the glucose meter result. The Benedict's reagent test results, the color change is closer to an orange color, indicating a level of over 2000 mg/dl. This is considered extremely high and abnormal. I can determine this since a normal color shade would have resulted in blue, equating to a value of under 100 mg/dl, which is considered normal. However, my patient is seen in the picture provided to have a result of an orange color, indicating a very high level of glucose. A third test for my glucose determination on my patient was a urine strip test. The results did conclude the same as the Benedict's reagent test, which was a level of over 2,000 mg/dl. If the results would have been normal, it would have been a light green shade indicating under 100 mg/dl. However, this was another result of over 2,000 mg/dl, so it was considered to be another abnormal result for glucose. So 2 of these tests did indicate results of over 2,000, whereas 1 test did indicate results of 200. Since all 3 of these tests determined abnormal results for glucose due to elevated levels, but 1 was a different value, we would proceed to investigate further with more clinical tests. For the enzyme kinetics results, our CK test results were normal since the difference was between 50 to 70. I can determine this is normal since the normal range for an adult woman would be between 15 to 160 UL. 50 to 70 for our patient does lie between 15 to 160. The LD test results were normal since the lowest difference was 130 to 140. I can determine this is also normal results for our patient X, as the normal range for an adult woman is 100 to 255 UL. These results do conclude that our patient has normal enzymatic activity, and typically higher levels will indicate any risks with glucose. A urinalysis results will include protein test results that showed no formation of precipitate. So our patient's previous urine color was a light yellow, so it was normal. And after the protein test, there would have been a precipitation that would have formed if there was an abnormal sign. However, for our patient, there was no formation of precipitate. Therefore, our results were normal. The pH and specific gravity results. The SG was normal, given the color shade orange at a value of 1.030 sec per seg. The pH was shade red, indicating an acidic level of 4.5. A normal pH would have been around 7, so our results for the pH were abnormal as they were very acidic. A panel was also ran for the electrolytes that reflected normal results of decreased phosphate ions in our patient's panel. Ketone and bilirubin test results were also concluded to have reflected abnormal ketone results that reflected a purplish color with a value of 4.0 mmol over liters, and bilirubin was negative due to the cream shade. If the ketones would have been a light cream color, then that would have indicated for negative or normal results. However, ours reflected a higher color of purple, reflecting a larger number. So abnormal for ketone results as well. The Ehrlich's reagent test results indicated no color change in the urine, so normal results for this test. I can conclude this since the abnormal results would have reflected a red color change within 30 seconds of the test being performed. The primary diagnosis based on all of my test results and conclusions would be hyperglycemia. This can be concluded by the extremely elevated levels of blood sugar seen in my patient, normal enzymatic activity, and low pH. A patient with hyperglycemia would indeed have symptoms such as frequent thirst, fatigue, and frequent hunger, resulting in a great appetite. Alternative diagnosis for my patient was diabetes. However, it was ruled out due to the normal levels of LD and CK and extremely elevated blood glucose levels that indicated further than diabetes, which is hyperglycemia. Ultimately, the diagnosis has levels past type 2 diabetes, aligning with hyperglycemia as the final diagnosis for my patient X. The treatment plan for my patient would be to prescribe medications to control blood sugar levels. Medications can include insulins, sulfonylureas, and metformin. Any of those medications will work for my patient, as they all will target on controlling the blood sugar levels from spiking in my patient. I would also suggest lifestyle changes to my patient. So this could be anywhere from focusing more on a low sugar diet and less snacking and more nutrient rich meals, and also including in some exercise so that we can work on being able to keep our sugar levels balanced and controlled in the aspects that we're able to control them at home in our lifestyle. So I would also recommend my patient to be monitoring her blood sugar levels at home as well. That way, if anything does start to spike, she can immediately make an appointment and we can move forward with further treatment. So, this treatment plan, it will ultimately help alleviate symptoms for my patient by lowering the level of blood sugar to a normal non-diabetic range. And if further treatment is needed in case of emergency or excessively high levels, then treatments such as IV fluids and electrolytes can be used to help the body get rid of the excess sugar quickly and help the body quickly recover from hyperglycemia. These are my references concluded, and that is all. Thank you so much.